Just doing the final bits and pieces before we get started. But welcome everybody to our webinar today, returning to a COVID-safe workplace. My name is Chris Demopoulos. I'm the Marketing Director here at Safetrac. Safetrac for 20 years has been the online business training provider specialising in compliance training across Australia, New Zealand and the rest of the world. We are conducting a slightly different webinar today. We're really encouraging you guys out there to participate and ask questions. So using the Q&A and chat tools in the toolbar to pose your thoughts and questions that you'd like answered around this topic to our expert panelists. So our expert panelists today we have online with us. We have Deborah Coram, who is our CEO at Safetrac, and Helen Jennison, our Head of Content and Client Services at Safetrac. So they're both online there. We'll jump into what we're going to cover off today. Today we're looking at the state of play. Where are we at with the COVID-19 situation? Then going into, as a leader, what you will need to know and do for your organisation. How to then create a COVID-safe workplace. And lastly, looking at how to educate staff on what they need to know and do. So handing over firstly to Deb to take us through the state of play. So Deb, over to you, and you'll need to be off mute.
That mute button's still getting me. 9 weeks into working from home, I'm still learning the unmute button. Good afternoon, everybody. Thank you so much for joining us today. It's a very important topic we're talking about today. We're all excited to be talking about getting back to work as opposed to not going to work. So it's great to be here today to be talking about this topic. I'm going to move straight on to the current state of play with the COVID pandemic within Australia. And of course, the current state of play is actually an incredibly important part of our duties as a workplace, is staying abreast of what is actually happening with the COVID-19 pandemic within our work environments and within the social environment in which we operate. But currently in Australia, we have 497 cases that are active. We have 6,622 people who have recovered from the virus and 103 deaths. And there are currently something like 1,100 clinical trials going on to test vaccines. There is currently no effective treatment for COVID-19, and accordingly, it is incumbent upon us all to ensure that we do everything to protect ourselves, our workplaces, our workers, and our visitors to our workplace on preventing any further spread or infection of COVID-19. Now, there's a pretty unusual situation because never before has a workplace been required to prevent a socially transmitted disease from entering the workplace. Flus and gastros have gone around workplaces for years, with workplaces not being held responsible for their spread. Yet now with this pandemic, we have been placed upon us additional workplace obligations that we need to adhere to. So in terms of those obligations, the question that we're being asked by our clients the most is, do I really need to worry about doing stuff in my workplace? Do I actually have to do it? Do I need to worry about this socially distancing stuff in the workplace and 4 metre square rule? Is it like a recommended thing, or do I actually have to do it? Do I have to buy sanitizer, or is it just something I should do if I'm a good person? Well, the short answer is yes, you have to do it. Effectively, you are required under our workplace laws. So we've had amendments to both our federal and state regulations in relation to how to deal with COVID-19. And the officers of your organisation have been charged and are now legally required to ensure that they take a COVID-safe workplace principles approach to doing everything they can to promote a healthy and safe work environment for the people who visit their workplace. And that involves, as in terms of who is an officer and who is bound by that duty, Generally, in a small business, an officer is an owner of the business. And in a larger business, it's anybody who makes or participates in the making of big decisions about a big part of your business. And they potentially have the ability to impact or affect your organisation's financial standing. So anybody who holds that sort of role has a responsibility under the workplace laws to ensure you do everything, and the words are reasonably practicable, to ensure that you would do everything to reduce the risk of infection of a COVID-19 virus entering your workplace and infecting your workers. So in terms of where this obligation has been placed, if you look at the Safe Work Australia website and you go to each of the states and territory WorkSafe websites, you will find large amounts of information telling you what you need to do to comply. And in fact, the guidance tools that these websites have created for workplaces are extensive but very useful, and a terrific guide for you in terms of following what it is that you need to do. The states and territories ultimately have the responsibility of providing the advice, education, compliance and enforcement. And if we go to the next slide, you will see that, and where everybody who's at this presentation, we are going to send a copy of this PowerPoint to you after the presentation. And this slide here is an interactive slide that will take you to each of your relevant state body and the forms and toolkits that are available from them for your businesses. And it's really important that you look at the website in terms of your specific industry. So they have updated the toolkits and the information depending on the sector that you operate in. So the rules and the regulations are going to differ a little bit depending on the type of workforce that you operate. Things like PPP are going to be less required for an office-based worker versus somebody who's front-facing to somebody that may have a COVID-19 infection. So you're saying that the rules of social distancing are different in schools than they may be in another environment. So these individual state websites will take you to industry-specific information that you can download and read and make sure that your workplace is compliant with those requirements. Today, because we've only got a short amount of time, we are going to focus on what the requirements are in an office environment. But if you're, say, a corporation that's a retailer, you're probably going to have a head office and you're going to have retail stores, which means the rules are going to differ a little bit between what your office requirements are and what your retail store requirements are. So we encourage you to look at both of those when looking at these regulations. So today we're going to move forward with what are the requirements and things that you should be doing for an office environment. So as a general overview in terms of what you, as an officer, you need to be looking at, all officers have a duty of care to ensure the health and safety of the staff and anybody else who enters their workplace. Now, anybody else entering that workplace might be customers, clients, visitors, delivery drivers, anybody who potentially enters your workforce. As an officer, this doing everything reasonably practicable to eliminate and minimise the risks of injury include both physical health and psychological health. So we're talking about an obligation to look after both the mental health and well-being of the people who enter your workplace, as well as the physical aspects. So what do we really need to be doing to ensure that we're doing that? First of all, the first obligation is, as I mentioned at the beginning of this seminar, you need to be monitoring all of the government websites and the health websites from both federal and state guidelines as to what is the current status of the guidelines from government and the COVID infection. So at the moment, most states have been invited to return to a workplace. Victoria still remains that if you've been working from home, you must remain working from home. So there is a small difference between the states. So if you're an organisation that operates nationally, you need to be cognizant of each of the different state recommendations that you need to be following. And because this is a constantly changing beast, we need to be constantly monitoring those updates and ensuring that our workplace is compliant with those updates. So this is not a one size fits all and just once. This is a thing that we are going to be required to constantly monitor as an officer until this pandemic is over. So this is not a one-off activity that we're undergoing. This is something that we need to continually be cognizant of until there's a vaccine and until we are through the thick of this pandemic. So we need to ensure that we have looked at our workplace in terms of the business we operate and the risks that are incumbent within our own individual workplace, and how that could affect the workers and the visitors that come into our workplace. We need to make sure that we have got adequate resources to ensure that we can manage those risks that we've identified. So in terms of ensuring those resources, that might actually be people. It might be that you need to appoint certain people into certain roles to be monitoring, to be updating, to implanting controls. We need to be ensuring we've got the resources in terms of supplies for things like sanitizers and cleansing equipment. So we need to look at what the resources are going to be required in your organisation. We need to implement adequate controls to guard against the risks that have been identified. And once we've done that, we then need to take a full review of our organisation's policies, procedures, and reporting processes to ensure that they adequately address the risks of COVID-19 and the controls that are being taken. All of those materials need to be updated wherever necessary. We then need to communicate those updates with both our workers and our visitors so that everybody understands what new processes and procedures are going to be put in place in our workplace. As part of that communication, it is essential and a requirement under the legislation that we provide proper instruction and training to our workers and visitors on the things they need to be doing to help managing the risk of a COVID-19 infection spreading in your workplace. We then need to continually monitor that those activities are going on in our workplace, that people are complying with those policies and procedures. To the extent that they're not, they need to be enforced. And to the extent they don't work, then we need to tweak our controls to ensure that they do. And then it really is a vicious circle as we then continue to monitor updates, update, etc. So it's really this constantly evolving circle that we are going to have as a duty as officers for the next however long as this pandemic runs. So in terms of what are the actual tactical things we need to be doing to creating a COVID-safe work environment, I'm going to hand over to Helen, and she's going to run through what we need to do to be preparing both our workplace and our people. How's?
Thanks, Deb. I managed to get the mute off as well. So thanks, everyone. I'm going to go through a few things on this slide. Basically, if your workplace pre-COVID-19 was anything like ours, you would used to get a lot of deliveries, both work-related and personal deliveries to staff from their online shopping adventures. So you will probably need to review your policies in line with any shipping and receiving to ensure that you have the most hygienic and safe precautions in place. Many workplaces, including our own, had deliveries of fruit and kitchen staples and milk, etc. And policies around these may need to be reviewed as well to avoid any unnecessary touch points. You may also need to review who receives the deliveries and potentially provide your staff with PPE if they're handling deliveries, such as gloves or masks. Sorry, that's a bit better. Is that better? I'm sitting up. Someone said they couldn't see me. It goes without saying that hand sanitizer should be available for both staff and the delivery drivers, and if possible, contactless methods of delivery and receipt should be used. Many workplaces will start discouraging visitors from attending their offices. But if they must attend, you'll probably need to make a policy that management approve any visits for these. In these new times, it's also very easy to forget social distancing rules when meeting someone new. I know for instance, I had a plumber out to my house the other day, and without thought, I introduced myself and shook his hand, and he had a look of complete and utter horror on his face. But I didn't even think about it. It's just something that I have always done. And so we need to retrain our whole social etiquette behaviours. And this is needed, and it's going to be needed to be more reinforced than just putting signs around the actual office. I had a client mention to me the other day that some of their team have returned to the office, and given that they hadn't seen each other for a long time, they forgot straight away about physical distancing rules and all gave each other hugs. We need to communicate with staff prior to returning to work and ensure that they understand that physical distancing needs to remain and is the same and has been during isolation. It's up to management to model this behaviour that they want staff to show and communicate with them about this. Talking about the whole physical distancing thing, you may need to look at your workspaces and how many people can fit in them, and so you can abide by the 1.5 metre rule and the 4 square metre rule per person. You may need to alter workstations and ensure meeting rooms only hold as many people as they should. Potentially this might mean closing off small meeting rooms so they're not inadvertently used. While many organisations in the past had staff hot desking, this now poses a significant risk for the transmission of the virus. So workstations have a number of high touch surfaces, including keyboards, mice, phones, and touchpads if your team are hot desking. This approach may need to be rethought. All employees should ideally be provided with a dedicated workstation and equipment. So Chris, you've already moved to the next slide. Thank you, Chris. So I'm just going to go through building systems now. If your building has been shut down for many weeks, it would be prudent to ensure a thorough inspection of it prior to allowing staff back on site. This inspection should include assessments of physical conditions and operation of equipment such as air conditioning and fire life safety systems. You may want to increase the fresh air intake in your office, check kitchens to remove shared items such as crockery and cutlery, and ensure adequate signage of new kitchen policies are in place. Safe Work Australia has advised that the social distancing rules do not need to be observed in elevators. However, you may want to consider how you will manage the flow to the different floors of your office and what additional cleaning is required and what capacity your elevators can take. If you're planning on implementing some form of queue management in the lobby of your building, social distancing will be important there. So potentially, like we've seen in our supermarkets, you could create floor markings to set out safe distancing requirements for people waiting to embark. In lobbies, common areas and amenities, you may want to modify current practices and you may want to train staff in them. Like the kitchen, remove things that are high touch and consider your policies in relation to gyms, end of trip facilities and reception areas. Next slide, please, Chris. Okay, it's incumbent on you as a manager or officer to ensure that your workplace is clean for the return to work. You should consider all high traffic common areas and think about the need to provide hand sanitizer, surface disinfectant, wipes and tissues. Obviously, there's a need to also have appropriate waste receptacles to dispose these items in. Whilst PPE is not mandated by government guidelines, it may be appropriate to have some in stock, but even if you don't do this, you should communicate to staff that they are welcome to bring in their own if it makes them feel more safe, and certainly do not allow them to be made to feel uncomfortable for doing so. You also need to review frequent touch points, such as light power switches, kitchen taps and equipment, doors, drawers, shared items like printers, chairs and desks. Make sure they are clean and disinfected regularly. Potentially review your policies on all of these. For instance, discouraging staff to print, or at least providing sanitisation so they can wipe down shared equipment, such as printers or conference phones after use. Again, the need to ensure that this kind of information is communicated to staff is absolutely imperative, and to do so before they actually come back to work. So I think I've covered most of that on this topic, Deb, so I'm going to pass back to you.
Fantastic. Just one point that I want to make, and I'm going to address a question live that somebody's just asked that I think is really relevant, is failure to do all these things, is it going to render our workplace liable to a workers' compensation claim if it's not followed? The answer is short is yes. So if someone were to contract COVID-19 through your negligence of not taking these cares, and it could be proved if the person got that infection in your workplace as a result of that negligence, then yes, that worker would be subject to a workers' compensation claim. And yes, your officers and directors could be potentially held liable for failure to comply with workplace health and safety laws. I think that may actually be addressed somewhere, but I just wanted to make it very clear that these are not nice things to do. These are requirements under the legislation as much as any other work health and safety law is. I think that's a very important point. So something else that is, and there's definitely some things like that that are causing confusion. I want to clear a few of those up. And it's to the extent, we've had a few questions that we'll address at the end of this presentation that are really useful things to clarify. One of the things is the COVID-safe app. A lot of workplaces want to mandate that their staff download this app. And especially they're saying, well, it's a work-based phone. I can tell my staff that they must download that application. You actually can't. So whilst we would encourage you to encourage your workers to download the app, you cannot mandate the downloading of that application. The downloading of this application must be voluntary, and indeed forcing your staff to download the app can render you in contravention of the Biosecurity Act, which has a penalty of 5 years imprisonment, a fine of $63,000 or both. So this is not something we want to be mandating our staff to do. So I am now going to flick back to Helen, who's going to talk a little bit about preparing our staff for that return to work.
Okay, let's go to the unmute again. Thank you, Deb. Okay, there's several factors to consider when deciding when and who should return to the physical workplace. Obviously, a lot of this is common sense. If any of your staff have underlying health issues, are caring for vulnerable people, or have long commutes in, it may be safer for them to remain working from home for as long as possible. On the flip side, obviously, if it's suspected that any are suffering from something like family or domestic violence, these people should be prioritised to return to the workforce when they can. Again, it's important for any return to work to be communicated effectively with your team. You don't want anyone to feel like they're being singled out, treated unfairly, or discriminated against for making them return or not return. A lot of organisations are contemplating either a staggered or phased return to the workplace. That is, they'll either stagger their team, so only half of the team are in the office at one particular time, or phase the team so they can start at different times to prevent them from all having to catch peak public transport. Both have pros and cons. However, from talking to a lot of my clients, many of them are looking at the staggered approach, having two teams, Team A and Team B, coming in on alternate weeks. Again, it's very important to review your policies, your risk registers, procedures and training to ensure that all of this information is communicated consistently throughout the organisation. Could I have the next slide, please, Chris?
Well, and just a point there I just wanted to make about the staggered approach. The reason that the staggered approach is gaining in popularity is because effectively you have two teams of people that are at an A and a B, or maybe even an A, B and C team. And in the event that there is an infection that happens to one team, you've still got another team that is not barred from entering the workplace and can continue to work as a team and hasn't been subject to that infection. So the risk of contagion is less amongst that sort of approach than people who are just coming in at all different hours of the day. We're going to have everybody in the one workplace at differing times throughout the day. They could then all be subject to that infection that entered your workplace. So it's really to protect the workers, but it's also to protect your ability to continue to operate, is the reason that a lot of workplaces are implementing this process. Sorry, Hels, I just thought that was a good point.
No, definitely. Thanks, Deb. So whichever approach you do decide to bring staff back into the workplace, they will most likely be more at risk getting to work than they will be when they're actually physically in the office. So potential solutions to this is providing car parking if it's available for staff so that they don't have to take public transport, or providing them with potential incentive schemes to purchase bikes, etc., if they live close by. It's important to make sure that anyone who is catching public transport does sanitize their hands, etc., as soon as they get off the train, tram or bus. As Deb's mentioned previously, legally speaking, health and safety legislation requires workplaces to be, as far as reasonably practicable, both physically and mentally safe and healthy for all employees. This means that steps must be taken to ensure that the working environment does not harm mental health or worsen any existing mental health condition. Most of our employees have been working from home for many weeks now, and you need to be aware and sensitive to their mental health after being in isolation for some time. It's understandable for those who have been housebound to feel a little intrepid about getting out and about in the world again, and they may feel anxious about travelling and being around people. The reality is everyone is different and will feel differently about returning to work. So it's very important to communicate and empathise, thank you, with each staff member about their return to work and how they're feeling about it generally. Next slide, please, Chris. Thank you. So this is all, I did see a little question pop up before, and hopefully this will explain this a bit. You need to be careful to monitor anyone who appears unwell or has symptoms that are consistent with COVID-19. If someone at your workplace is confirmed to have COVID-19, you may also need to notify your state or territory health and safety regulator, as it may be a notifiable incident. This differs from state to state, so be sure to check your Safe Work Australia site to confirm your legal obligations around this. If you do have reasonable grounds to think someone in the workplace may be sick, you need to do quite a few things. You need to obviously isolate that person straight away, ensure they put on a PPE mask. You need to call the COVID-19 helpline and follow their advice. Ensure that the person who you believe or suspect may be ill has a secure method to get back home or to their medical practitioner. Disinfect all the areas that person had access to and in line with official advice that you will receive, and potentially quarantine other staff members that may have been around that person. You should encourage staff to get tested if they do have symptoms, but you cannot force your staff to get tested. However, if you suspect anyone has symptoms, you can prevent them from entering the workplace. It's also a government regulation that anyone who is displaying symptoms must isolate themselves, and anyone who has been in contact with them must quarantine themselves for at least a 14-day period. So I think I've finished on that slide, Deb, so I'll pass back to you again.
Thanks, Helen. I think we just had a question about the last point, which was a staggered return and how it's run. The question is, it depends on what works for you and your organisation. Some people, as I said, some people have an A and a B team and they're taking alternate days. Some days are doing week on, week off. Some days, some people have A, B and C teams, each taking alternate days or alternate weeks. So it really depends upon the size of your workforce how those staggered teams would actually work. So at least a couple of people from each department, so that you've got cross-channeling across departments. And then how the size of your workspace, given the social distancing rules, you may find that you're not going to be able to have your whole workplace in your work environment at the one time anyway, because it won't allow for the social distancing that you need to be putting in place. So you might find that you need to run a staggered approach simply because of your workplace size. So it really depends on a number of things in terms of the teams, the makeup of your teams, what works for you, and the size of your work location. Moving on to a conclusion to this presentation is, I mentioned at the beginning, you have an obligation to train your staff. We've been asked about this repeatedly because we've been telling people you must train your people. And they're like, why? Who says that we must? Well, the legislation says that you must. So you must provide your workers any information and training that's necessary to protect them from the risk of exposure to COVID-19 arising as a result of them attending your workplace. Again, when you are sent this presentation at the end, this link will take you to the direct link in the legislation that shows you whether your training is a requirement under the legislation. And Chris, if we move to the final slide, we have just released 3 courses that will meet this legislative obligation. There is 2 courses on how to prepare your workplace and how to prepare your staff, and then a general training course for all of your staff that will teach them about what they need to be doing to be COVID safe in your workplace. All of those courses, like all Safetrac courses, are easily customizable so that you can adjust those to ensure that your policies and the specifics of your workplace are updated into those courses. It does take a little bit of time to update those courses and make those changes, but it's really important that you are training your staff in what the specifics are of your workplace and the changes that you are making to your workplace. Some workplaces are requiring staff to undertake temperature checks, some start, and it really depends on your workplace as to whether or not that's a reasonable thing to do or not. So it really depends on the risks that you identify as your unique workplace and what procedures you've decided to implement. The courses we have drafted are in relation to a standard office environment and probably don't require much customization other than perhaps a linking of your individual policies that we can put in as resources to those courses. And I will just say, Chris, if you move to the final slide, as thanks to attending this seminar today, we are giving anybody who wants to purchase these courses and roll them out to their staff an hour of free customization as part of the purchase, if the purchase is done by the 30th of June. So basically, we'll update these courses with your unique policies and procedures and you know, up to an hour's work of changes so that you can roll those courses out to your staff. And if you are an existing Safetrac client, it's very easy for us to add that course to your existing subscription, and we will just roll that out to whichever staff you ask us to. And if you are not a current Safetrac subscriber, those courses are available on our platform and we can have you up and rolled out between 1 and 2 weeks. And if you have your own platform and you want it as a SCORM file, we can deliver those as a SCORM file to your own learning management platform where you can roll it out. And of course, it's needless to say, because training is an obligation, you do need to have an auditable trail of the fact that you did train your staff. So I can certainly attest to the fact that Safetrac platform will provide you an auditable trail to show a regulator what the efforts are that you went to ensure that your staff were adequately trained in this subject. And of course, that training depends on their role in the organisation. Managers need managers training as well as the staff training. Staff need the staff training course. So that's all the content that we're going to cover right now. I would say that content is much more, is covered in much greater depth in the course. We've only got a short time today, so we tried to do it in a fairly compact summary. We've done as much as we can in the time we've got because we wanted to leave some time to answer your questions. Chris?
Yes, we do have quite a number of questions, which is great. We've seen some really good interaction from everybody.
We love questions.
Well, that's good. All right, some questions for you then. We'll go with the first one that's come up, asking how to manage staff who say they are having underlying health issues or at high risk and want to remain working from home on an ongoing basis. There's been a couple of questions actually around this, both before the seminar and also now during the webinar. How can we approach that one?
Yeah, it's a great question, and I think it's something that most workplaces are going to face. We've got a lot of staff who are working from home and they really like working from home, so can we tell them they must come back to work? So again, it's subject to your local legislative requirements. So in Victoria, you cannot require anybody to go back to work right now who has been working at home during this period of time. So it is dependent on your state legislation. But as a general rule, where somebody's refusal to return to work is based on something general, like, oh, I'm worried about being infected, that is not a relevant grounds for refusal to return to work. I like working from home, or I'm worried, is not sufficient grounds for refusal. However, if there is a reasonable risk to that employer's health or safety, they may have a valid reason for refusing to attending work. And this might include where something like co-workers have known to have been infected, somebody in the workplace has travelled to an at-risk destination without quarantine or isolation. It may be that they don't believe your workplace has put in place necessary processes and procedures to guard against the risk of COVID infection. Another reason you need to be taking this very seriously and doing everything you reasonably practically can do to ensure you have removed risks from your workers. At that point, there's no valid reason for them to refuse returning to the workplace.
Brilliant. Thank you, Deb. We've had a couple of questions actually for Helen around the kitchen aspect. So you mentioned the high touch cutlery in shared kitchen. Do you see any need to provide provisions like tea, coffee, sugar, or are we encouraging people to bring their own? Or when you say remove kitchen appliances, do you mean kettles, microwaves, etc.? Can you just clarify that point for us, Hel?
Sure. So it's very dependent on your organisation. Recommendations are that probably you should ask workers to bring in their own cutlery and crockery and remove shared items. We've had a lot of clients also mention to us that they're going to ban using the dishwasher, and people have to wash their own utensils and cutlery and crockery. Again, having anything that has got a lot of touch surfaces or could harbour the virus means that you should be very sort of wary about having anything that multiple people are touching. So it, again, completely dependent on your organisation and what your requirements are. But I know that if we return to work, we will be bringing in our own cutlery and crockery, and we'll have most of the office staples that we used to get. You know, there's no more little digging our hands into the cookie jar anymore. All of those kind of things will need to be brought in by staff. Everything that you can do to ensure that you're doing everything reasonably practicable to ensure your staff's safety should be done. And if that means that staff have to bring in their own food and coffee and things like that, then that needs to be done. With regards to appliances, again, I've had people say that they won't be allowed to use dishwashers. Obviously, microwaves and things like that can probably still be put in place, but they would need to be sanitized after every use. So every time someone touches that little touch point on the microwave, they would need to sanitize that, and you would need to monitor that as well. Deb, did you want to add anything more to that?
Again, it's what's reasonable in your workplace. I've heard of some workplaces appointing a kitchen monitor, and there's only one person allowed in the kitchen to touch the kitchen equipment. that might be a reasonable thing to do in your workplace. Again, it's about removing risk points and frequently touched in the removal of as many frequently touched surfaces as you possibly can.
Okay, great. Thank you. Hopefully that helps our viewers out there. Another question from our registration actually was, if someone does have a temperature, what actions can you reasonably take? So Helen, if you could answer that one. I think there was actually a question on that too through our chat too.
So, sure. So I know that some workplaces are having temperature control stations put in. Employees can issue a reasonable and lawful direction to their employees to participate in temperature testing. However, that process should be adopted sensibly and based on the level of risk of each business. So for instance, in a high risk context such as aged care, such a requirement is more likely to be reasonable than in an office environment. So it's, again, you know, you can do it, but it needs to be reasonable and it needs to be a lawful direction.
Excellent. Thank you for that one. Okay, let's go for another one here. Do you have any sort of advice or guidance, Deb, I'll throw this one to you, on sort of best practice recommendations for things like community centres, assisted living or in-home settings? So I think it's like an aged care industry that this person was coming from. So the sort of, I guess, guidance for that person.
Yeah, again, I'm at this point, I'm not a specialist in the individual practices that need to be adopted by those businesses. But again, I commend that you go to that WorkSafe and those safe work websites that have specific information for individual industries that will address the specifics that you need to be doing in those environments. So it's incumbent on you to look at the legislation in relation to your business sector and what applies within that sector. And that has all been mapped out very, very clearly for you. Chris, I noticed a question which is,
yeah, go for it.
I love the question because it's difficult. Can we require our staff to get a medical clearance before returning to work? So the reality is, if you have had a COVID-19 infection, that person will be under the guidance of a medical officer, and they will not be given clearance to return to work until they are cleared of the infection. And when they have actually had the virus, they will be given medical clearance to return to work. So yes, that you can absolutely require that person. Is it reasonable and lawful that we said, well, before anyone returns to work, they must provide us proof that they don't have the illness? It really depends on whether or not that is deemed to be reasonable and lawful. So what is reasonable and lawful is a subjective standard at this point, and we're yet to see these rules tested in terms of what they actually mean. So if an employer were to direct you to have a medical test before you could get to work, it would be reasonable to expect that workplace paid for that test. And that may then well be a reasonable directive. So we're still waiting clearance on things like that. I think it depends on if you're, for instance, were in a school or a highly transmissible environment, such as an aged care zone, I would say it's probably reasonable. That's my subjective opinion. I don't say that's the law. That it would be reasonable that people do not have the virus. So some formal proof that they don't may well be reasonable. Is it reasonable in an office? I don't know.
Excellent. We are at time, and I know that we've got another good half a dozen type of questions. Is there anything that is in that sort of question and answers section that jumps out to you that either of you would like to jump on, and the rest then we can follow up after the seminar, if that's okay with you?
Yeah, so I think a really important one that has just come in is, are you allowed to have, thanks Fiona, are you allowed to have a team morning tea if hand sanitizer is supplied? Well, I don't think you should feed your staff the hand sanitizer, so probably a coffee would be better. But I think that you can, of course, get together as a group. And of course, that's what all of us are missing. We're missing that team collaboration. You are allowed to collaborate so long as you follow the rules. So you need to make sure that the room that you're collaborating in has a 4-meter square space for every individual attending that room. You need to make sure that the people in that meeting are physically distanced from each other by 1.5 meters. You should, and in the event that were not possible, given the type of work or collaboration you do, you should probably insist upon the wearing of PPE to prevent transmission. And again, that's what's reasonable in these circumstances. And then, yes, you should be ensuring that there is sanitizer at that event. Things like team meetings are likely to have things like whiteboard markers. No sharing of whiteboard markers unless you're wearing gloves. Otherwise, individuals should have their own whiteboard markers. All the whiteboard markers needs to be sanitized being passed between people. It's little things like that we take as just part of our given way of work. Oh, we've got going to the whiteboard, we're going to walk on the whiteboard, write on the whiteboard, here are my pens, put the pen down, next person gets up to the whiteboard, can't do that anymore. So you need to start thinking about what the tools are that you're going to need in that meeting and how you're going to facilitate the sharing of those items if there would usually be a sharing of those items. And so if you are going to have a collaborative environment, you really need to start thinking about how that is going to work and how do you follow these rules in relation to that collaboration.
Another point, Deb, is potentially, if you can, hold it outside in a big park.
Yep, great.
You know, you can fit quite a few people in a big park, and they're not all, and it's sort of, there is evidence to suggest that it's not as infectious in outdoor areas. Yeah.
And it's unfortunate we're hitting into winter to go and have these lovely outside meetings. So yes, there is that. But yes, that's a great idea. And you'll notice that the social distancing requirements that are coming from the government are larger numbers of people in the outdoor spaces for that exact reason. So if you've got a larger group of people and you can't fit them in the morning tea room that you've got whilst abiding by those laws, then an external meeting is a really good idea.
Yeah.
That's great, thank you. I think we've got another good half a dozen, 10 questions there. I think we might have to cover those off separately and come back to everyone on those ones and circulate along with the presentation and the webinar at a very near date. So yes, not far from this, we'll be circulating this presentation. Thank you all for attending, and we'll be able to answer your questions anytime in the future if you'd like to give us a call or send us an email. Thanks very much, Helen and Deb.
Thanks, everyone. Thanks so much for coming. We really appreciate your interest.
We do.
Thank you.
And thank you. And everybody stay safe and keep your workplaces safe.
Yes, definitely.
Take care.
All right.
Thank you.
Bye.
Bye.